Hello, Dr. Eakin here at Total Illusion Aesthetic and Wellness Center, and I'm delighted today to be able to discuss with you my weight loss program that I have developed here for my patients, where I incorporate the latest peptides, Wegovy and Mounjaro, otherwise known as semaglutide and tirzepatide. So, before we begin, just to go over some known facts about obesity, that you are not alone in your struggles. In fact, 1 in 3 persons in the United States are struggling with being overweight, and that joins 2.6 billion worldwide. Essentially, in the United States, both men and women are pretty much affected equally if you adjust for age, and all age groups are affected. We know that there are health risks involved in being overweight, with essentially all organ systems being affected. But the one area that we don't really discuss much is the social emotional impairment. And what came first? Is it that impairment that led to the weight issues, or is it the weight struggles that potentiate the negative effects of the emotional and social impairment? I'm going to argue and say that it's a combination, and I think both inhibit each other and reflect negatively on one another. So I'm sure many of you have asked yourselves, why do I always fail at losing weight? It's a never-ending battle that you never seem to win the war on. And I'm here to tell you that it's because diets by themselves don't work. And more exercise is not always the answer. We were told, oh, you need to eat less and exercise more, but that's very basic. And it's not the total reason for weight loss struggles. And that's one of the ways that makes my program different than many, is that this is a comprehensive program that's going to address all those different issues affecting weight. Because my goal for you, as it was for myself, is for long-term success. I don't want you to complete this program and then all of a sudden you've gained the weight and then some back. So this program is going to explore 360 evaluation of you, your lifestyle, your health, your behavioral, so that way you can have that long-term success. And I think that while there are many great, diet plans out there, um, like Weight Watchers and Nutrisystem, the one thing that they don't address is the behavior component of it and this 360. So you do well, you will take in less calories, but you get to a point where you sort of plateau and you can't get beyond that plateau. And I think a lot of people can relate to that. Certainly a lot of people who seek me out for this program, that's the one thing that they say, is that they've tried and tried and they get to a certain point and they just cannot get beyond it. And that's where this medication comes in very, very well. So 63% of the population has tried to lose weight at least once, and a third of those have tried to lose weight at least 11 times or more, all to have failed. And another reason for it is that as our weight is decreasing, our ability to burn more calories decreases. And on top of that, we have a fivefold increase in our appetite. So if you've ever worked out and got into a workout routine, you'll notice that all of a sudden you feel like you're more hungry. And that's because your metabolism is increasing to keep up with the needs that your body is burning. And this is where another point where this medication is really helpful is that it's not speeding up metabolism, it's keeping you status quo, but you are decreasing your intake and you're burning fat. So we discussed that obesity is multifactorial. Again, it's not simply calories consumed versus calories burned. We must take into all the factors that can affect consumption, as well as all the factors that can affect your metabolism. And this is not always solely organic. There's other social, emotional, lifestyle issues that are at play here, and this is what we address. So, to appreciate where we are at today, we really need to take a look and see what we've had in the past. And weight loss drugs notoriously have been known for their very bad side effects, and some of them even causing mortality, and certainly coming with a high level of morbidity. Probably the most one that most notorious one in recent years was fen back in the 90s, where it was affecting the heart and the lungs and caused severe and sometimes irreversible damage. Interestingly, the fen part of it, the FEN, the fenfluramine, although that has been banned, the phentermine part of it, the PHEN, is still available on the market today. And actually, surprisingly, a lot of these drugs are still available on the market today. But the one thing that you'll notice with all of them is one, that they are an oral medication that you do have to take daily and sometimes more than once daily, but they all affect metabolism in a certain way. And we know that having a ramped up metabolism all the time can have its deleterious effects. So usher in the new injectable medications that has not only taken diabetes by storm, but the weight loss industry by storm. And the reason being is that one is that it's safe medication and highly effective. Originally, these medications were developed for diabetes, type 2 diabetes. And the idea was that if you could do a once a week injectable medication, you could increase compliance. You could be more effective because you're targeting very specific receptors. And you can have a multifactorial effect on the individual. So Ozempic was the first one that came out. And this is the one that a lot of influencers and those in Hollywood were taking. It was being used off label for weight loss. And then in 2021, Wegovy came out, also a semaglutide. And then that was just recently FDA approved last year for weight loss. And then last year, we also had Mounjaro that came onto the scene, which is a slightly different medication because it acts on two receptors instead of the one, giving you a little bit more uh, better results, but with the potential of a little bit more side effects, which I'll go into in a little bit. That did get FDA approval at the end of last year, and it's going to be marketed as Zepbound. So, what makes these medications so unique is that they act on a very specific receptor, the GLP-1 receptor, which is found in the gut. And the reason this is so important is that you are targeting a very specific point. And in doing so, not only do you increase efficacy, but you also increase safety as well. So with the Wegovy and well, actually with all of these medications, you're slowing digestion. So the food is hanging around a little bit longer in your stomach, so you feel full longer. It also decreases the motility in the gut as well, again, leading to that feeling of fullness. It releases insulin, which you would expect because it's used as a diabetic medication. But what that does for weight loss is that it destroys fat because it is inhibiting another hormone called glucagon. And glucagon is important for storing fat, where insulin acts on destroying fat or increasing the fat metabolism and reducing fat deposition. The interesting thing about tirzepatide or Mounjaro is that it acts on the brainstem and the hypothalamus to tell your body that you're full. So you're not that constant food seeking effect that you need the food to feel good, and you feel good because you have food. Uh, and this is also another area that they're looking at if you've heard about the recent ones in regards to addiction with this medication. And not that you get addicted with this medication, but using it in people with addiction because it acts on the hypothalamus. It's also cardioprotective, especially in women. So there are recent studies that have come out to show the cardioprotective effects for both of these drugs. So, what about safety? All of those who know me know that safety is my number one priority. I won't bring in any new procedure or any new device or any new product unless it is safe. And it took me a little while because of just the bad reputation that weight loss drugs have had in the past. But after a long time researching and then developing how can I bring this into my practice and be effective, I have realized that these drugs are safe. Also, what's important to know is that they have been reproduced. The original results have been reproduced in other populations in other countries, and they are consistently getting similar results. So you know those original results and studies were valid. So it's a very important point that these results are replicatable. Both the semaglutide and tirzepatide are considered safe for long-term usage, which of course is very important because these are going to be used originally in diabetics, and they're going to be using it definitely long-term. So you need something that is safe. The side effects, just like with any medication or any procedure, you're always going to have some risk and side effect involved. Not surprisingly, that the side effects are GI side effects, which makes sense since the receptors are in the gut and in the intestines. The most frequently reported ones are nausea, heartburn, diarrhea, and constipation from the studies. I would say in my practice, what I've seen the most common one, and with myself as well, is heartburn. And it varies in its intensity. One week it may be good, another week it may be slightly worse, and then another week I may not have any, and my patients may not have any. It tends to happen right around the time of the injection, probably in the first 24 hours of the injection, and then fades as the week goes on. It is also possible for, you'll be cruising for a few weeks, not have any, and then boom, that fourth week, you're like, all of a sudden I'm feeling the heartburn, and then it'll go away the next week. So it's very variable, but nothing to the point where, oh, I don't want to be on this medication anymore because the side effects are so bad. The side effects were reported to be dose dependent, and just like with anything, the more you give of one thing, the more likely you could experience side effects from that. I will say with my protocol that I use here, I do low dose, so I'm not doing those high doses that you see. In other places, and one that allows me to be highly effective in the inch loss and the weight loss, but also really minimizes the side effects. So it's going to be very interesting over the course of these next couple of years when I can gather all my data together and show that you can be very successful at this and stay on the low dose. I think we all should be focused on the lowest, most effective dose. Excitingly enough, there was no reports of severe low blood sugars. So this is really important in those who are not diabetic, to make sure that we're not lowering the sugar too much so that you go into hypoglycemia. There have been reports of decrease in muscle mass, and it's and this is, we don't know if this is directly a cause of the medication, or is this because in those original trials patients were on a low caloric diet, and anytime you are not consuming the appropriate amount of protein or the appropriate amount of calories, you can have a decrease in muscle mass. In addition, each year we have on this earth, we are losing muscle mass. So it's really hard to say at this point what's contributing to it, but we know that that is something that's being seen. So I tell everybody, whether you're on this medication or not, we really should be doing weights and strength training for many reasons, but also to combat a potential side effect. So speaking of efficacy, this has been phenomenal. So you're seeing anywhere from a 10 to 22% decrease in overall total body weight. The 22%, that's more of when you're those who are doing the tirzepatide or the Mounjaro. The 10 to 12%, and I even seen up to 14%, is more of the Wegovy, Ozempic, or the semaglutide patients. Most are losing about 6 to 8 pounds in the first month. This will differ based on each individual, how much weight they have to lose, what they're currently doing. I tell everybody you're not focusing on the weight because that's going to change week to week. You may be up a couple of pounds, then you may be down a pound, or maybe totally status quo, no change, and then all of a sudden you drop 4 pounds. So I tell everybody, remember, this is long-term goals. We're focused on the end game. We're not focused on the short-term success. Overall, you're going to be losing the weight. But what's more important is that you're losing inches. And I'm going to explain why that is so significant later on in the presentation. You have a decrease in hemoglobin A1C by 2 to 4%. This was known because these were originally the FDA trials that were on diabetics. So that's why they went up to 4%. So this is great for those who are pre-diabetic, as that can take them out of that range. I don't know that I've seen a huge drop in hemoglobin A1C in patients who are not pre-diabetic. But I have seen, and everybody does report, an improvement in their sleep, an increase in energy, their exercise tolerance improves, and their overall mood. They also report being more productive in their work, in their daily life. Relationships with friends, with family have all improved because of this. And overall, just an improvement in their quality of life. In regards to blood pressure, I've definitely seen a decrease in blood pressure and in those who are having higher blood pressures, but it doesn't make somebody with normal blood pressure have a low blood pressure. And also there's been improvements in cholesterol levels as well. So our program, or my program that I have developed here, is unique in that it's a physician developed and implemented, and I also have gone through the program myself, so I know it works. But it's a comprehensive program that's not only going to be providing you with the medication, but we're going to be looking at all aspects that is contributing to your weight loss, which is different than most programs out there. You're going to be seeing me for your office visits. Initial office visit is going to be quite in depth. You will be completing a detailed questionnaire that's going to go through many questions about all aspects of your life, as well as your medical history. I'm going to be asking for recent laboratory data. So if you have not had any within the last 6 months, we'll go ahead and get those ordered for you so they can be reviewed. And then we will probably, depending on the results, we will repeat those later on in the course of the treatment. We're going to be obtaining measurements, and this is crucial because we need that objective data. We're going to be checking your weight, of course, but like I said, we're not going to be focusing on the week-to-week weight. I'm going to be focusing on the overall trend. I'm going to be most focusing on your abdominal circumference and body fat levels, because this is what I want to see drop. We know that BMI is what we all use because that is the tried and true, the most studied. That's what insurances also use. But we know that that is not as indicative of your cardiovascular risk, your insulin resistance. It's actually the fat around your belly is what is more determining of your health risks for a cardiovascular event or for prediabetes. So we really want that to come down. And so we will be watching that in patients who are having great weight loss, but have not reached their abdominal circumference that I want them to be at healthy. Then we will continue with the dosing and vice versa. So I want to make sure that both of those are addressed, as well as the total body fat. I'm not trying to make everyone, lean and with zero, with 4% or 10% body fat. It's getting down to a healthy level for each individual. So this program is very personalized, and it's not a one size fits all. So we also have a nutrition and fitness component to it, which is very valuable. I have partnered with a local expert who can help you very individualized and go over your eating plans as well. I also have a overall plan that I discussed on what your goals should be, and we tailor this to your current lifestyle. So I'm not going to tell you cut out all sugars, all carbs, um, only eat protein, never have another piece of cake in your life, never have another glass of wine, because we know that's not going to work long term. Yes, you may be able to do that for several months, maybe even a year, but for the rest of your life, are you going to say, I'm never going to ever have another glass of wine, or I'm never ever going to have a carb again? And actually, your bodies need carbohydrates, which I won't go into all that detail now, but just know that statistically, over 95% of people who cut out one thing from their when they're dieting fail, and they regain the weight back and then some. So we make this very personal. I want to um, have um, small changes for big results and long-term success. And you're going to see with this medication, because it acts in the brainstem and the hypothalamus, your relationship with food is going to change, and you're not going to want it. I've been starting backing down on people who have reached their goals. And so we're backing down, and they don't go back to eating their old ways. They don't. It's just has reset this new set point. And it's been very fantastic. We also discuss fitness goals as well. Um, and then that's also something that you can add with the local partnership as well. Adjunct therapy is huge. And again, this is another area where we differ from others, is that we have the technology to support you. We have state-of-the-art equipment here to help you. We have the mSculpt Neo that not only burns fat, but increases muscle mass. So you're doing, for instance, on the abdomen, you're doing the equivalent of 18,000 crunches in 30 minutes with no pain and no burning in your muscles afterwards, or muscle fatigue afterwards. It's just really great. And then we have the M-tone as well for sagging skin. So we don't, trying to minimize the loss of elasticity there with the decrease in weight. There's also vitamin injections, collagen supplements, just a whole host of ways to be able to support you so you can have this full 360 improvement in your health and wellness to help you maintain those goals. Accountability is paramount to success. The majority of patients who come to me say that the one thing that they have not been successful, they think that they have not been successful before, is the accountability. So definitely here, you're going to have maintenance visits with me. I'm going to be seeing you weekly, and we're going to keep that accountability going. And then then as we get later on into the program, there is opportunities for me to see you once a month, depending on what your degree of comfort is in self-injection. So we have different ways to make sure that we are staying in touch. I also do telehealth calls as well. So just to make sure that you always have support with you. So let me give you real results of what has been going on in my practice since I started this specific protocol. So looking at the data after the 12-week introductory phase, so these are just people who have completed the 12 weeks, and then we go on to the maintenance therapy. They're losing anywhere from 6 to 10% of their body weight within that 12-week period. 3 to 6 inches in their abdominal circumference. The 6 was myself, and I noticed that by using the technology like the mSculpt Neo, I really just saw the inches melt away, and I was also getting stronger in my core as well. And this is one thing that I have seen, is that patients who are doing the technology tend to lose twice as much as those who are just doing the medication alone. Also, yes, I agree, there was a decrease in blood pressure for those with high blood pressure, but no decrease in those with normal blood pressures. Improved exercise tolerance rather, and this change of relationship with how they view food and improved social emotional status, like I had mentioned before, which is very similar to those in the trials. To give you an example of one patient who has completed the 12-week introductory program, is on the maintenance phase. This was her result. So you can see um, real real inch loss here. These results were taken from a body scanner, which all my patients now have access to. So it is part of the initial plan that you can go over, and you will have your body measured by um, a standing machine. So for her, at the start of the program, she had a chest of 41 inches, measuring 41 inches. And by 8 weeks into it, she had already lost 2 inches off of her chest. And again, this is somebody who did not do any of our devices, but does follow the workout protocol. And at 21 weeks, she was down almost 37 inches. The waist went from 34.5 to 30. Hips, which is an area that a lot of women complain about. She's lost 5 inches in her hips. Thighs also a 3 inch, and biceps also went down. What's interesting about the biceps in this particular individual is she actually was decreasing, and then all of a sudden she had a slight bump. And what's interesting is when she flexes, you can actually see she's more lean now, because she has been working out the biceps, and losing that extra adipose tissue really helped her to tone up. So, who's a good candidate for the program? Well, pretty much anybody who is wanting to lose weight and has weight to lose. So, ideally, for the initial FDA approval was for those with BMIs of 30 or more, or those with a BMI of 27 or more who had at least two weight related issues. So, like blood pressure and cholesterol, I'm sorry, one weight related health issue, not two, one. But we know that there's people who are outside of this scope who definitely can benefit from the program and can do it safely and effectively. And those are typically ones who are, have been working out and have just stalled. Our body likes homeostasis. It likes to get into a groove and just stay there. We don't really like change. And so a lot of people who say they've been on a diet or they've been working out and they just can't move the needle on the weight or the inch loss, this is a great uh, medication for them to be able to just get over that hump and stay over it. Also, those who are on long-term medications with weight gain is a side effect. They will also have difficulty losing weight by just exercise and a diet alone. Individuals who can't work out because of the weight, or maybe they have some physical impairment, great for them as well. And then just persons who, despite their best efforts, still have stubborn fat that they cannot get rid of. Really, the only ones that are a poor candidate would be those who are not committed to making lifestyle changes. I don't allow those into my program who are just looking for an easy fix, just for a medication to help them along, because again, my focus is on your long-term success. And if you're not committed to making the changes, then you're not going to have long-term success. So I don't want you using this as a crutch. I want you to use this medication as a stepping stone. Individuals who are seeking to lose a few pounds before an event, again, it's not worth the side effects. You don't want to be taking a medication for the wrong reasons, and that's not the right reasons. I tell everybody who's starting this program, you're going to be on it a minimum of 6 months, and the reason being is probably 6 months to a year to get down to your goal weight, depending on where your starting point is. Of course, those who have more to lose, it's going to take them longer. And the reason being is I want to do this in a slow and steady, way that gives you that long-term success. You don't want to shock the body and lose 30 pounds in 1 month. That's not um, the best for the body, and certainly not the best for the skin. Plus, I want to be able to teach the body these good lifestyle modifications and behavioral modifications. And you don't want to be doing that. You can't do that effectively for long term success in under 6 months. You really need to get that habit and then have that habit stay, and then you can start slowly backing off the medication. So we may not be a year at the same dosing, but or 6 months of the same dosing, depending on where your starting point is. But we are going to continue this medication for at least the 6 months to a year. And then those with a history of thyroid cancer should not be a candidate for this medication, or with a family history of what's called men type 2. So, how do I get started? It's easy. You just schedule a consultation. You can either phone us, you can go online and set up a consultation with me, or you can send us an email and we'd be happy to get that set up for you. It'll start off, you'll get the, so some things to consider is once you set up the appointment, we will send you a questionnaire. To have that questionnaire completed would be ideal before you come and see me, so I have time to review it, and then I can ask you some supplemental questions when you come in. And then it'll also help me to start working on a preliminary plan for you. And then I would also ask that you bring in or email over your latest labs, even if it has been over that 6 months time. Just I want to see what your latest labs were, and then we'll make a decision on if we need new ones, and if so, which ones. So thank you so much for your attention today. If you have any questions, don't hesitate. Please reach out. I'm happy to answer them, and I'm excited for this new phase in your life. Take care.